Good afternoon, everyone. I'm Nirav Shah, I'm the director of Maine's Center for Disease Control and Prevention. I'm delighted to be able to join everyone this afternoon to talk about where we are with COVID-19 across the state of Maine. I'm also delighted to be joined by Commissioner Jean Lambrou, Commissioner of Maine's Department of Health and Human Services. Commissioner Lambrou and I would like to talk about where we stand with COVID-19 across the state of Maine for today, Tuesday, March 2nd, 2021. I'll start things off with a couple of updates and then turn things over to Commissioner Lambrou. As of this morning, there have now been 44,944 cases of COVID-19 statewide, representing an increase of 182 cases since yesterday. Of those cases, 35,311 are confirmed and 9,633 are probable cases. 703 Maine people have died, sadly, and overall, among all of our cases, 4,193 have been among healthcare workers. Since the beginning of the pandemic, 1,536 people have been hospitalized with COVID-19. And right now in Maine, 69 individuals are in the hospital with COVID. 25 of them are in the critical care unit, and 8 of them are on a ventilator. In terms of where we stand with respect to testing and positivity rates, our positivity rate in Maine now stands at 1.35% on a 7-day basis, with a testing volume of 672 PCR tests for every 100,000. Now, one note on that positivity rate. It has started to creep upward a little bit after hitting a low point about a week and a half ago. That positivity rate has started to tick upward, not just in Maine, but across North America, as well as across Western Europe and Northern Europe. We're not sure at this time what that increase may represent. Folks who look at our data on a close basis may have also noticed that the decline in cases that we see has certainly been remarkable over the past 6 weeks, but that decline has also slowed a little bit. While we're not seeing the multiple hundreds of cases that we saw 6, 7, or 8 weeks ago, we're not seeing a continuation of that reduction. That, coupled with the slight increase in the positivity rate, it leaves open a question of whether this is just a natural biological fluctuation in a very complicated system, or whether that positivity rate might start to tick upward and be coupled with an increase in the overall numbers of cases. We've been asking some of our epidemiology team to look into this more deeply to try to see if there are any patterns that we can see in Maine and compare those notes with what other states are seeing as well. We'll have much more to discuss around this as more data come in and as we analyze it. Turning now to vaccines and vaccinations. There have now been a total of over 350,000 COVID-19 doses that have been administered across the state, 355,810 to be exact. Of those, 231,353 are first doses, and 124,457 are second doses. To put those numbers in perspective, as of this morning, 17.2% of Mainers had received at least their first dose of COVID vaccine, and about 9.25% of Mainers had received 2 doses, both doses of the COVID vaccine. Now, one note on the data there. The arrival of the J&J vaccine, a single dose, changes several things. I'll start with one of the more, the data-related piece. As the J&J vaccine is starting to be administered across the state, that will be reflected in our second dose numbers. The second dose really reflects completed doses, individuals who have completed their vaccine series, whether it's of the Pfizer and Moderna vaccine, which is 2 doses, or of the J&J vaccine, which is just a single dose. So those numbers of the recipients of the J&J vaccine for right now will be included in our second dose numbers on our website, because that represents those who have completed their COVID vaccine series. But let me pause just for a moment to talk about the J&J vaccine as well. We talked a little bit about some of the science underlying it a week ago. The J&J vaccine has been shipped and is starting to arrive across the states as well as in Maine yesterday, today, and some tomorrow. As a result, providers across all 50 states as well as Maine will start administering it yesterday, today, and tomorrow. As we talked about last week, I have great confidence in this vaccine. Indeed, I had the opportunity this past Sunday to participate in and listen in on discussions that the US CDC convened as part of their advisory committee on immunization practices. This is a group of experts across the country, and I had the privilege to listen to their deliberations, who analyze the data, and they go really deep. They kick the tires really hard on the J&J vaccine to try to understand where and how it might be best used. I came away from that opportunity listening to that discussion with great confidence in the vaccine, even greater than I had last week. And so I would just like to reiterate a couple of things. The first is, if you happen to be up for vaccine or vaccination, and the J&J vaccine is what's being offered, that's the vaccine you should take. After having heard those conversations on Sunday, I had the opportunity to talk to some of my own family members across the nation. And I reiterated to them what I'm saying to you, what I said last week, and what I'll say again. The best vaccine that you can take is the one that is closest to your arm. If that happens to be a Pfizer or Moderna product, great. If it happens to be the J&J product, great. We are in a pandemic right now, and we are racing to vaccinate as many people as we can across the state, across the country. The J&J vaccine performs incredibly well against the COVID-19 virus, as well as some of the emerging variants. Indeed, one of the benefits of the J&J vaccine is that because of when it was tested at the peak of the pandemic, as well as where it was tested, Brazil, South Africa, as well as in the United States, we have a good understanding of the fact that it performs very well against some of the emerging variants. All of this suggests that, again, the best vaccine for you to get is the one that is closest to your arms. The J&J vaccine also opens up new possibilities of vaccination efforts across the state of Maine. It's the type of vaccine that, because it does not require that ultra cold freezer, and because it can be safely administered in one dose alone, it's the type of vaccine that we can bring to individuals rather than asking individuals to come to the vaccine. We are right now happy that Maine this week has received 11,500 doses of the J&J vaccine for state level distribution, as well as, and something that Commissioner Lambrou will talk about in a moment, 3,500 doses for us to utilize in conjunction with our retail pharmacy partners. Those 15,000 doses are doses that we are expecting and working with providers to get into arms as quickly as possible. But we're simultaneously working with the federal government to understand what the supply of that vaccine looks like for the subsequent few weeks. The way that the vaccine was produced is that the vaccine was produced up until the time that the US FDA authorized it. And once that authorization came out on Saturday, the federal government cleared the shelves of the vaccine, pushing all of it out the door to states. We are working to understand how much more vaccine will be available over the coming weeks. We've been told that the supply of vaccine may drop off as they are spinning back up their production in order to produce more vaccine. Now, how much that supply drops off is something that we are working to understand right now in partnership with the federal government. We applaud them for pushing out as much vaccine as they could so we can get it into arms and keep running this race against the variant. But now we have to understand what the supply of that vaccine looks like for all of us in the state for the next few weeks. Once we have a better sense, because of these natural fluctuations, we will let everybody know. This was not unexpected. Indeed, after the Pfizer vaccine was approved, as well as the Moderna vaccine back in December, we saw that the first week we received a lot of vaccine, and then it tailed off for a few weeks as the factories were upping their supply and ramping it back up. We expect that the same will happen with J&J, But right now, what we are trying to understand is what the exact magnitude of that will be and what it means for all of you in the coming weeks. We will have more updates on that as we learn more from our federal partners. And with that, I'd like to turn things over to Commissioner Lambrew.
Thank you, Director Shaw. I am excited to announce that Maine is activating a third pharmacy chain as part of the U.S. pharmacy program. Hannaford supermarkets will begin COVID-19 vaccination at 35 pharmacies across Maine later this week. It expects to receive 3,500 Johnson & Johnson doses from the federal government over and above the 11,500 doses of the Johnson & Johnson vaccine that Maine announced yesterday its distribution plan for. Hannaford stores and pharmacies located throughout Maine are staffed by experienced healthcare professionals. Vaccines will be available by appointment only through Hannaford's online scheduler that can be found by searching hannaford.com pharmacy COVID-19 vaccines. Also announced yesterday is that the Penobscot County Health Center will receive 1,000 doses of Johnson & Johnson, also on top of the state's allotment. PCHC is the largest federally qualified health center in Maine and is well positioned to serve vulnerable, marginalized, and rural populations. For example, it has already been providing vaccines to homebound seniors from Greater Bangor to Millinocket and Medway. This allocation of vaccines will allow its staff to serve even more Mainers. Altogether, this means that 55,060 Pfizer, Moderna, and Johnson & Johnson vaccines for first doses or only doses in the case of Johnson & Johnson will arrive in Maine this week. That is more than double the doses that arrived 2 weeks ago. This comes during a week that Maine not only expanded eligibility for vaccination to people ages 60 to 69, but also opened new large throughput sites. Today, the Portland Expo opened its doors. It will start administering 500 doses initially and then ramp up to 1,000 doses per day. It is in the center of Portland, the largest population center in Maine, and will be accessible by foot, by car, and by public transportation. Northern Light Health has engaged cultural brokers to make it welcoming and accessible to new Mainers. It is an exciting new option. Also today in Sanford, the former Marshalls, located at 1364 Main Street in Sanford, is opening its doors as well. This partnership between Maine Health, the York County Emergency Management Agency, and the Maine Center for Disease Control and Prevention will welcome new patients, again, starting at about lower amounts, but ramping up to 1,000 doses per day. It will be serving York County, which is a little bit behind on its vaccination of its residents. So this new opportunity will hopefully be able to allow York residents to get the vaccines that they're eligible for. You can find where you can be vaccinated if you're eligible by searching for Maine COVID-19 vaccine sites. And again, it's all by appointment only, as we're trying to make sure that people can get their vaccines as efficiently and equitably as possible. But it's an exciting new week, and we're happy to answer questions about all these great new options. Dr. Shaw?
Great, thanks, Commissioner. And with that, we will turn over to our colleagues in the media. The first question for the afternoon goes to Morgan from WABI.
Dr. Shaw, Commissioner Lambrew, thank you for taking my questions today. My first question is about the new age-based approach, and I'm sure that you've heard concerns with frontline workers who feel like they have been pushed back even further, teachers, et cetera. Some have also reached out to us talking about how they feel slighted seeing that the US CDC is not taking this approach or does not suggest this approach. My question is there a way at some point with more supply coming in to add in some of those workers who were deemed frontline essential workers into the rollout, into the plan?
Sure, I can start, and then Commissioner, please. Morgan, I think where we start and what we've discussed is what is the overarching principle that underlies why we are vaccinating folks. And on that score, Governor Mills has numerous times stressed that the principle that she is striving for, the ethical reason why we are vaccinating, is to save as many lives as possible. And proceeding by age, because age is a strong predictor, a strong indicator of things like mortality or severe disease, proceeding by age allows Maine to save as many lives as possible. That's doubly important in a state like ours, with the highest or second highest average or median age of any of the other states. Now, we recognize, of course, that any approach right now is one where we had to choose between a number of imperfect solutions. That's unfortunately the nature of a pandemic, but the proceeding by age not only allows us to save the maximum number of lives, it also allows folks to have a clear sense on the calendar of at least by when they may be able to access vaccination. We know that that news was unwelcome for many. It wasn't necessarily what folks wanted to hear, but it does mean that we can proceed as quickly as possible. The more folks that we can vaccinate in the shortest amount of time means that those who have not yet been vaccinated are still afforded protection because of that population level immunity. So the more folks that we can vaccinate and tamp down the levels of the disease, the safer all of us will be, especially in light of the variants that we now see emerging, not just in Maine, but across the country. Commissioner, please, what did I miss?
I'll just add 2 points. I think the point about the variant is one I would like to underscore is we have to be worried. That's our job, is to look over the horizon and see if this highly contagious variant will arrive in force in Maine and change the positive trends that we've been seeing recently. As such, this point of trying to vaccinate as many people as quickly as possible is our primary goal, alongside this idea of preventing illness and death. So those two things in tandem drive towards this type of solution. And going back to the US CDC, I think it's important to remember it was a set of recommendations by an advisory group. Those recommendations also changed over time. And we know that every state's doing this a little bit differently. We wish we had the vaccine to be able to vaccinate all 1.3 million Maine people right now, but we don't. These are hard choices, and we understand some of the frustration out there.
My next question is about the clinics that you mentioned on Friday, Commissioner Lambrou, for teachers. Would that be something that happened at the schools, or would that be some sort of drive up? Can you kind of talk more about that?
Sure, and we are still working on our plan for that. We expect to announce that by the end of the week. But as a reminder, we announced that within the age group that's currently eligible, we will work with providers to have dedicated clinics for age-eligible school staff and teachers. And our plan is to divide up the state and the school districts to identify a clinic for each of our school districts, work with our superintendents on those age-eligible school staff and teachers to let them know where they can go and on what days. And I think we're hoping that we can do this all at once, dedicate a Friday and a Saturday that will be for teachers and staff who are age 60 and older, to be able to give them an opportunity over and above the opportunity to go to what we just mentioned, this new Sanford site or the Portland Expo or the Hannafords or PCHC. This is an option that's an extra option for teachers and staff. They can certainly go to other sites, but we are affording this because we recognize that trying to get more children into classrooms is a priority, and making sure that the teachers who are age eligible get vaccinated is important. But again, we'll have more details hopefully by the end of the week.
Thank you both.
Thanks, Morgan. Let me turn to Chris Costa next.
Hi, Dr. Shaw and Commissioner Lambrou. Thanks for taking our questions today. Just a quick clarification on the Johnson & Johnson vaccines that are going to Hannaford. I think you guys had mentioned earlier, Dr. Shaw, that you weren't quite sure what the longevity of or the consistency of that supply is going to be for Hannaford. But if Maine continues to get those extra allotments in addition to what the CDC gets, will they continue to go to Hannaford? Am I understanding that correctly?
So a little bit, Chris, you are understanding, you are understanding it correctly, but I'll just for extreme clarity, the vaccine that is being administered at Walmart initially, then Walgreens, and now soon Hannaford's, comes directly from the U.S. government, directly to those commercial pharmacies as part of a retail pharmacy program. It is not debited against or coming out of the supply that otherwise comes to the state of Maine. So the J&J vaccine is part of that retail pharmacy supply. And so it's not something that we are slicing off and sending, but rather a supply that is going directly to, in this case, Hannaford's, with other vaccines going to Walmart and Walgreens. Again, we are trying to get a better sense of what the stability of that supply chain looks like, not just this week for the 3,500 doses that Commissioner Lambrou noted, but also for the subsequent weeks as well. We're trying to work with federal partners to get more clarity on what that supply looks like. We know it will likely go down. What we're trying to understand is by how much.
Okay, but that and the allotment that for example, a Hannaford will get, which I understand is separate from the state's allotment. That's not taking away from our other federal retail partners like a Walmart or a Walgreens, correct?
Correct. It is not. Okay. They are all getting different vaccine.
Can you help people understand a little bit why some of the counties in the state seem like they've done a very good job with their first dose of vaccine rollout? Some of them have already increased to near 20% of its populations that have gotten a first dose. And it seems that the rate at which they're able to administer the vaccines has been faster than other counties. Do you know why that might be the case? Is it availability of sites, or does it have something else to do with doses?
Chris, I'm glad you raised that. And we too have been tracking that. I know that you yourself have been keeping up maps on that. There are a lot of things going on. But Chris, one thing I want to just focus on is which variable in particular that we are looking at. The one that we zero in on, among others, is not just the percentage of the overall population, but specifically the percentage of those 70 and over, now 60 and over, who have received both their first and now their second doses. The reasons for the variance vary by county. In some instances, we know that there was not enough supply, not enough access points. Hence the discussion that we've had already today and why we're so excited for the site in Stanford to open, because that was an area that was underserved. And we know that 1,000 shots a day in that part of York County, when they get to that level, is going to be very welcome. And I don't think they're going to have trouble filling it. In other instances, there are other factors at play. There might be differences in the degree to which folks are willing to drive, so on and so forth. One really important point to note, Chris, for you and everyone as you're looking at the data, those data track where people live. That's not where they get their shot. So if someone from Waldo County drives to Penobscot County to get vaccinated, those numbers are tallied on Waldo County's ledger, not on the Penobscot County ledger. So it is partly a function of where folks are willing to go and when.
That's very, very helpful to understand, Dr. Shaw. I really appreciate that.
Sure,
last
Chris.
question. Last question is more of like a behavior kind of thing. We got this from a viewer. Curious about people who all say there are groups of friends, groups of families, perhaps, where everybody has been vaccinated. But they are still concerned about the science kind of still being out on a person's ability to harbor the virus in their nose and mouth. I guess their question seems to be, what's the best practice for people to make sure that they're not inadvertently spreading the virus when they gather with other people who have all been vaccinated and spreading it to somebody who's not been vaccinated?
Oh, Chris, I want to just recap the scenario really quickly because the facts matter here. But there have been emerging data for the past several weeks now that suggests that it is unlikely that someone who has been fully vaccinated, so a few weeks, 2 weeks after their second dose or first dose in the case of J&J, it becomes with each study less and less likely that somebody who has been fully vaccinated could harbor the virus in sufficient loads or sufficient volume to actually transmit it to somebody else. And so as a result of that, in fact, Dr. Fauci himself took the position this past weekend that in a setting like you mentioned, Chris, where everybody who is, say, attending dinner has been fully vaccinated 2 weeks after their last dose, they should feel free to gather with one another and not feel the need to wear masks. The vaccines are that good. Indeed, if anything, we have been underselling the vaccine and its efficacy at reducing the likelihood of transmission. I myself was not sure where the data landed on this, but after trusting Dr. Fauci's analysis, he himself went out this weekend and said that groups of people who are all fully vaccinated, everybody in the group is fully vaccinated, they should feel free to resume activities like getting together for dinner and not feeling the need to be masked. Now, this is, again, assuming they're in a closed location, away from those who have not been vaccinated, that sort of thing. But that's just an example of how effective these vaccines are and how they all enable us to turn the page on the COVID journey that we've all been on.
Thank you.
I might just add, though, that it will, though, be a while before our public policy changes, because that scenario is not all that common. If you go to a restaurant, you're not going to know if the person at the next table or the group at the next table has been fully vaccinated. We're not going to be able to be in public spaces and know which person has been fully vaccinated, who hasn't been. So I do think it's important to note that this may be a private policy that can be effectuated for people who are fully vaccinated, but it will be a long time before a public policy can catch up.
Absolutely.
Thank you both.
Mm-hmm. Thanks, Chris. Let me turn it over to Amy Brown next.
Thank you. So people with a wide range of different medical conditions are believe now that they are at higher risk for either contracting COVID or having a worse outcome if they do contract COVID. But the information in Friday's press release, when the age-based changes were made, indicates that age is a much higher predictor of a poor outcome. So have some of the earlier concerns about the risks associated with particular health conditions proven to not be warranted, or is it just that age is a stronger predictor of a worse outcome?
It's the latter, Amy, for a few reasons. The first is that age unto itself is partly what's called a dependent variable. That is to say, someone who is of a very advanced age may have 4 or 5 medical conditions. Someone who's not as advanced of age may have 2 or 3. Someone who's even a tier below may have 1 or 2. But age is a proxy for many of the other health conditions that we know predispose somebody for worse outcomes with COVID. The other, and this is a tough conversation to have, but it's one that I feel like I can be direct with everybody about. Although almost any health condition may increase the likelihood that someone has a bad health outcome, it's still not as stark as what we see with age. And so there are conditions that increase the likelihood of bad outcomes by X%. But when you stack that up against what we see with age is still the one question that helps us sort out where people stack up when it comes to their risk of dying, which is what the governor has prioritized.
Okay. And is there already, or will there be some type of, and I don't know if this is a question for you, maybe it's more for Commissioner Lambrou, but some type of card or vaccination registry that people will be able to use when traveling, for instance, to prove that they've had the vaccines, that they're fully vaccinated?
Yeah, we certainly have heard about those ideas. I think in Europe, they're talking about a green passport, for example, that has to do with both having had a vaccine and maybe having had a negative test. We are in the process of reviewing here in Maine our own travel policy, trying to do the projections about how many of our residents will be vaccinated at what pace. Should we get some predictability with supply, begin to see the impact of vaccination? So I think it's too early to say what we'll be doing here in Maine. But I would note that if people do get vaccinated, they'd usually get a paper card as well as potentially a electronic indicator of their vaccination. It's always a good idea to hold on to that. It may come in handy at some future point. So if you are getting vaccinated, do get your vaccine card that says that you've had 1 dose if it's a Johnson & Johnson vaccine, or 2 doses if it's Pfizer or Moderna. It's a good idea to hold on to that.
So could something like that be part of the plan for tourism this summer, so that as people are booking reservations, they could just demonstrate that they, from whatever their state is using, that they've had their vaccine, and then the hotels and campgrounds can start booking as usual? Or
It's one of the many ideas that we're looking at. We are looking at that as well as other ways that we can figure out how to engage people more safely to move into a space where, with greater vaccine, with COVID-19 under control, we can do more things like travel. But I think it's a little bit early for us to speak to that, recognizing that we do have a little bit more work to do on the vaccination front before we can really talk about tourism.
Great, thanks.
Thank you.
Thanks, Amy. Let me turn it over to Patrick Whittle next.
Thank you very much, and happy Tuesday. I wanted to make sure I understand one element of the age-based tiers. Could you talk a little bit about how these are the sort of the future tiers when we get into 50 and 40 and below? How difficult was it, or is it, to plan for this when we're not fully cognizant of what the supply is going to be like? Because this doesn't sound like, it sounds like a plan that, because of supply, isn't able to be a hard promise at this point. Is that a fair way of characterizing it?
I think that is fair, Patrick. It's the best approximation that we have based on the data that we've been briefed upon around the potential supply of vaccine, as well as our best faith estimates around the vaccination rates in Maine. It could very well change. Let's hope that it changes in an accelerated fashion, not a decelerated fashion. But we wanted to, now that we have some sense of the stability of the vaccine supply, leaving aside the J&J note that I made earlier, we wanted to be able, with that stability, which is something that I've said we really needed before we could make those projections. Now that we have a sense of that stability, as well as a sufficient volume, we wanted to offer folks what we think is a reasonable dates on the calendar. Let's hope that they get accelerated, but as we know more, we'll update.
Okay, I see. Also, municipalities around Maine are starting to look at their sort of spring, summer, and beyond programs for another year that could involve a lot of outdoor dining and retail. We received a sort of a schematic of what Portland's is going to look like. Is there any guidance coming from the state about how that could be different this summer than it was last summer? Because last summer, prospects for a vaccine were not there yet, and this was all very new, and it was sort of slapdash in nature. But now we're entering a year where, by the summer, large portions of the population could have had the vaccine, and we might be, God willing, moving out of it.
Sure. I will just begin by saying, I know it may have felt slapdash. We did spend a lot of time working on those protocols, reviewing what worked in different states, looking at the evidence, trying to calibrate and adjust as needed. All of our prevention, COVID-19 prevention checklists are gathering limits and other guidance. So we are doing a comprehensive review of all that guidance as we speak, recognizing that things have changed. We know more about COVID-19. We know more about potential, inflection points. We know more about the vaccine. So all of that is being taken account as we look at what comes next, how to move Maine forward. I would note that Governor Mills is very focused on this. She recognizes the fact that we have to balance out what has been our North Star, which is public health, keeping Maine residents safe, with our economy. How do we begin to open up not just tourism, but different sectors of our economy that have been hard hit by the pandemic? So we, again, are undertaking this in an aggressive way. I don't think it'll be slapdash when it comes out. I think it'll be very thoughtful, and we are hopeful we will begin to get some engagement through the Department of Economic and Community Development on some of those ideas as well.
Thank you so much for that.
Thanks, Patrick. Let me turn it over to Megan from WMTW next.
Thank you for taking my question. So I imagine that the J&J vaccine opens up a lot of possibilities for Mainers who are homebound, or people who are Mainers who are disabled, who can't maybe get to one of the large scale clinics or even a doctor's office. I know you mentioned briefly a little earlier about some of the efforts to reach these folks. Is there a broader or more in-depth plan for maybe drive-up clinics, or bringing the J&J vaccine to them?
Yes, Megan. In fact, we'll go even one step beyond that. We are working on plans using different parts of our vaccination force, be it public health nurses, emergency EMS clinicians, as well as independent pharmacists, to go even further and provide vaccines in folks' homes. So home delivery of the vaccine, because for many homebound Mainers, even making a drive to a pop-up or a drive-through may itself be a challenge. So those plans are underway, and that is one of the strengths, undeniable strengths of the J&J vaccine. We're also investigating other venues that may, again, for other parts of the state, could be like drive-through clinics that were maybe not fixed large scale like we've seen, but maybe a few days a week trying to process as many folks, offering them vaccine in a drive-through fashion. There is a clinical question that's out there around the use of the J&J vaccine in a true drive-through setting. We're trying to get better clarity around that from the US CDC and whether it needs that observation period that we've all heard so much about. But make no mistake, the J&J vaccine, from a handling perspective alone, not needing to be put into a frozen environment, only requiring one shot, those two factors alone make it something that opens up many new possibilities for us.
Speaking of one shot, if you could clarify this, I've seen it that one dose of the Pfizer vaccine is sufficient for people who have already had coronavirus. Is this something that you recommend or support, or it's just carte blanche 2 doses, no matter what, to be considered fully vaccinated?
We follow in this regard the FDA's emergency use authorization documents, and FDA has said, and Dr. Fauci himself even has underscored that right now, the Pfizer and Moderna vaccines are both 2-dose regimens for even if someone has previously had COVID. I've seen the data that you referenced, that there are emerging evidence suggesting folks who have previously had COVID may only need one shot, but that really is a question for the FDA to properly vet and evaluate. If they change the EUA, that's something that we will then change and take a look at. As you can imagine, verifying who has had COVID, has it been within 90 days? Has it been more than 90 days? Et cetera, et cetera, et cetera. Those are all tough questions from an immunology standpoint. So we really look to the FDA to try to help us sort that out.
And if I could just follow up to something that Commissioner Lambrou had just mentioned, I think it was in reference to Patrick's question, but you were talking about the governor's careful consideration of when we might be reopening things or loosening restrictions. I don't know if it's preemptive, but is there any idea or timeline when Maine might be doing that?
Yeah, I think we are still closely watching our trends right now, doing a little bit more learning on, again, what's going on as well as what is effective. So I think I just don't have any timeline for you right this second.
Okay, thank you.
Great, thanks, Megan. Let me turn it over to Evan Popp next. Evan, over to you. All right, we'll come back to Evan in just a second while I turn to Patty White.
Thank you, Dr. Shaw, Commissioner Lambrou. Now that we're entering another phase of the vaccine rollout with the ages 60 to 69, what do you know about vaccine uptake among healthcare workers and staff and residents of nursing homes? Do you know what % of people in those or in those groups have been vaccinated?
We'll get the granular numbers for you, Patty, at least as we have them. What we've seen, or at least what I've seen, is that it's varied. As one would expect across any broad population, and I don't want to misremember a number, so I don't want to say anything for fear that it might not be accurate. But what I recall seeing is that there was a variance with some locations being very, very high, others being lower. We are working to come up with a manner to vaccinate residents as well as staff of, say, long-term care facilities who may be new residents and new staff who weren't offered vaccination during the first go-around, as well as those who may now wish to be vaccinated, having seen the very impressive statistics around the effectiveness of the vaccine as well as the safety. So we are working to try to go back to those places so that we can make sure everyone gets vaccinated.
Okay, thanks.
Mhm.
And there are people with high-risk medical conditions who are hoping that there's some way for them to be prioritized within the age eligibility categories. And you talked last week about the logistical challenges of determining eligibility according to medical conditions. But are there any, relatively easy ways to do this? For example, working with cancer clinics to prioritize patients. Are you considering anything like that?
Well, a couple of notes, Patty, and Commissioner Lambert and I have had numerous discussions about this. The first is throughout our vaccine allocation process, we have made sure to we have made sure to give vaccine to, for example, cancer clinics, dialysis centers, places of that nature, because we know that they are, of course, taking care of vulnerable patients. And we understand that and we thank them for that. And by equipping them with vaccine, they too can vaccinate their patients. Similarly, throughout the process, we've empowered providers on the ground because the providers know best which of their patients within the age categories may be at a higher risk than others. So we've empowered providers to try to come up with their own approaches to vaccinating folks within the categories that we've designated. So certain providers may say, for example, want to set aside or approach different categories of patients differently. We understand that, and that's something that we're supportive of.
Okay, thanks.
Thanks, Patty. Let me turn back to Evan. Evan, you with us? All right, we'll come back to Evan while I turn to Joe Lawler.
Yes, hi. Thanks for taking our questions. The first question, I know you were talking about a lull in the J&J vaccine after the first week, but are you still anticipating the Pfizer and Moderna vaccines to have, keep having ramp up, increase, accelerated supplies over the next few weeks, or do you not know?
We don't know exactly, Joe. What we've been told by the White House is that those levels of J&J and Pfizer and Moderna vaccine are not expected to decrease. And we're hoping that they will continue the consistent increase that we've seen for the past several weeks. That's the hope. That's our expectation. Now, what the magnitude of that increase is, we don't yet have clarity around.
Okay, and then about the teacher vaccination clinics, if you do get a lot more vaccines in the coming weeks, is there any thought about combining the age groups for them? Because otherwise, you'd be coming back and having clinics, 4 or 5 times with all the different age groups for the teachers.
So our plan is to primarily use existing clinics for this purpose, open them up again for extra hours, maybe on a Friday, open them up on a Saturday if they're not already open, and then just different groups of people would come in. So I don't think there'll be any logistical challenge of doing this in waves. And in fact, because we know there are about 10,000 teachers and staff in pre-K through 12 who are 60 and older, we can then plan for that. We know how many of these staff are eligible in each age bracket, and we'll be working on a schedule all the way through all of those age brackets to make sure that we have those special clinics lined up. So we don't think we need to do it for logistical reasons, and we are maintaining this age eligibility standard for the reasons the governor and Dr. Shaw previously described.
Okay, one more quick question. I know there was just an announcement of the Auburn clinic at the Auburn Mall. Are there other plans for mass vaccination clinics for Oxford and Franklin counties? And if not, is there a strategy to increase vaccination there?
Sure, Joe. I'll add not just Oxford and Franklin, but also Somerset County, which continues to be an area of need, we know, as well as Washington County. So for Oxford, Somerset, we're working with providers and consortia on the ground who can band together and start offering vaccine in higher volumes. That's an area, again, both of those are areas we know that there is need. Now, whether that will be a fixed permanent location that will be up and running for weeks, months, in the way that we anticipate Sanford, Portland, Bangor, Augusta to be, or whether they may be more occasional 2 or 3 days a week for a number of weeks. That's what we're trying to sort out right now. The other thing we're doing, and I referenced it, is we are asking and are supporting providers who wish to come together in the form of consortia, who band together and say, we as a group of providers would like to join up and offer vaccines in a public-facing fashion on the following days and the following times at the following locations. We're supporting those consortia when we see them. We've already, and we're doing so to the tune of around 1,000 doses per week. So for example, PCHC in Northern Penobscot, last week as well as this week, are receiving 1,000 doses. This week, it's directly from the federal government. Last week, it was from our allocation. I'm sorry, I think I said PCHC. I meant Penobscot Valley Hospital, not PCHC. I apologize for that. But similarly, another consortium we're supporting in Washington County, where providers came together and said, we will agree to work and figure out how to provide 1,000 doses a week. In areas of need, having providers come together and figure out how to achieve that throughput on a week-by-week basis is really instrumental.
And I'll add that part of the value of that U.S. pharmacy program is that we do have Hannaford's, for example, in these counties that we just mentioned. Of the 35 sites that Hannaford's is going to be opening, and again, note that not all Hannaford pharmacies will be activated this week. There's a subset of them. You can see which Hannaford pharmacies will be taking appointments on our Maine website, the Maine vaccine, COVID-19 vaccine sites. You can search that and find it. But we know that the Hannaford's in Skowhegan, the Hannaford in Oxford, they will be offering vaccination. So we have worked with Walgreens, Walmart, and Hannaford to prioritize those stores in those sites where we have potentially some of these access choke points. And that's going to be a big plus for rural Mainers in terms of access to COVID-19 vaccine.
Thanks, Joe. Let me try Evan one more time. Okay, the final question for the afternoon goes to Jessica Piper.
Thank you, Dr. Shaw. First, I wanted to follow up on your response to Patty's question. You had mentioned giving vaccines to cancer clinics and dialysis centers that they can give to their patients. Does that include patients who are under 70 or 60?
No, at this time, it's only those patients within those age categories that we are authorizing. At the same time, though, within those age categories, there may be a variance in which patients are at higher risk versus those who may be able to stay safe. And those providers may opt to, within their patient panels, say, we're going to focus on this group of patients first.
And I know the state has talked about speed being one of the reasons for trying to use these age categories. But in the case of like these cancer centers, wouldn't it be fairly efficient speed-wise for them to give it to their lower patients, to younger patients who might also be high risk?
I'm not sure, Jessica. Possible. It's not so much speed in that setting. When we talk about speed of vaccination, we're talking about speed overall as a state. The more people that we can vaccinate every single day means that we are affording protection all across the state. So it's not sort of site by site. It's as a state, the faster we can proceed and use up the supply that we get every single day or at the beginning of every week. If vaccine is coming in the door into the state of Maine on Monday and Tuesday, if we can exhaust as much of that as possible, as quickly as possible, that's an opportunity to keep people safe immediately. That's what I mean when I talk about speed.
And you've talked about how occupational categories and pre-existing conditions could slow that speed. Did those concerns come from providers?
They did. Indeed, they did partly come from providers in Maine, as well as concerns that have been relayed to me by colleagues of mine in other states. I think it's important to note that the medical officers at the two largest health systems in the state, Maine Health and Northern Light, both support the approach that we are taking for different reasons. In one case, because of the public health rationale that we talked about, but as Dr. Jarvis from Northern Light noted, also because of the operational considerations as well. I've heard similarly from counterparts of mine in other states, some of the challenges that they have encountered with verifying and making difficult decisions around how, is it all individuals with hypertension? Is it those with the worst cases of hypertension? If someone is religious about taking their medication for their hypertension, and it's well controlled, does that still count? And they've had to adjudicate many of these issues time after time, or alternatively, as a counterpart of mine in a Midwestern state told me, they just let people cheat. They just let people come in the door, and that's not equity. Opening up your doors to those 16 to 64 who just maybe have a chronic medical condition, but maybe they don't. That's not equity. That means that certain categories of folks can get vaccine when they're truly not at risk. Not entirely. There are always cases on the margin that are hard, and we should acknowledge that difficult truth. There will always be cases on the margins where there may be someone who is 58 years old with multiple medical conditions who is at a higher risk than someone 61 years old who is exceedingly healthy. Those cases are very, very difficult, but it illustrates how there's sometimes a disconnect in a pandemic, a challenge of doing public health, which we are charged with, versus private health. In an alternative universe, and I'll just say this, Jessica, in an alternative universe somewhere, they are also experiencing a pandemic, and there's a supercomputer there. And in that supercomputer, we can input everybody's age, complete medical history, profession, occupation, and risk. And we can put all of that in. And that supercomputer spits out a line of everybody in that jurisdiction and the exact scientific order in which they should be vaccinated. But we don't have that supercomputer. And even if we did, what algorithm would it use? What values would it use in coming up with that line? One of the benefits of the approach that we've taken is that it provides predictability as well as gives us a great sense of where people are likely to die.
I will only add that I agree with everything that Dr. Shah just said, but we share the frustration that we don't have enough vaccine to move as quickly as we would like to get to individuals. And irrespective of the numbers, if it's 1 or 100 or 1,000 of these individuals, we recognize that they too have faced the challenges of this pandemic, have had to stay home, have had to change their lives. So we do appreciate the concerns that have been raised as a result of this policy change. We do maintain, for the reasons that were described, why we're doing it, but just know we're coming as fast as we can to get you as well as others vaccines so we can move on with what's going on in our lives.
Mm-hmm. Hopefully the supply of vaccine will start to increase greatly, and we can talk about the acceleration of these schedules hopefully very, very soon. But that is entirely dependent upon supply. As Commissioner Lambrou and I have noted, right now, supply is the prime determinant of speed. So thank you, Jessica. And thank you all for the questions this afternoon. Just to recap, there is quite a lot going on across the state. We have, in the recent days, expanded and opened up new channels for Maine people to access vaccine. A large, high public-facing throughput site in Sanford, another at the Portland Expo, as well as now at 35 locations across Maine, the opportunity for Maine people to access vaccine at Hannaford's locations. Those come on top of what we hope to be more vaccine, certainly of the J&J vaccine this week, and we're working to see what that supply looks like for subsequent weeks. At the same time, as I noted a moment ago, we're starting to see some faint concerns on the horizon with a slight uptick in the positivity rate. We're keeping our eye on those things to see whether that signal means an uptake in cases or whether it's just a blip on the radar. We will keep everyone posted as we learn more about the supply of vaccine, the availability of more places to get vaccinated, as well as some of those epidemiological parameters that have now become second nature to so many of us across the state. We look forward to chatting with everyone soon in the near future. Commissioner Lambrou, before we adjourn for the afternoon, anything on your end?
Just a reminder that our policy, our vaccine sites, information about all these vaccines, that information is available at our maine.gov COVID-19 vaccine site. You also can call 211. We know that not everybody is as used to using computers as other people, so we do encourage people to try to find information. If you have questions, ask those questions, and hopefully with those answers, you too, when eligible, will get a vaccine.
Thank you. And I thank everyone for their time this afternoon. We very much appreciate it. We look forward to chatting again on Thursday. As always, and in the meantime, please be kind and take care of one another. We'll catch up again soon.